Loren is diagnosed with a condition called Clifford syndrome, which stands for congenital contractures of the limbs, face and hands and developmental delay. When Loren was first born, she was totally undiagnosed, so we didn't have any idea at all, so there was no answers to anything that we wanted to have. And it's extremely rare. We were one of the first ones to actually be called on that diagnosis. She can't eat, sit, walk, talk.
I think it's really difficult for families, especially when you've got a child with additional needs.
Spent an awful lot of time up in the hospital with loads of tests and examinations and appointments. Just got to the stage where I'd spend weeks alone in the hospital. The first year was horrific. The children suffered quite a lot.
Families are having like a bit of a difficult time and feel like they need a bit of extra support.
A lot of the time we feel very guilty, obviously, about putting one child above the others. But when one child has got high medical needs, you've got no choice.
I guess there's a certain amount of worry for siblings if they've got a younger or older sibling that is unwell and in and out of hospital, and I think it's nice for them to know that somebody comes in and they know that the child that you're caring for and that they're safe as well, and they can go off and enjoy time with like mum and dad and do normal stuff.
And normally when Loren has had like nurses and stuff come around, it's quite like medical and serious, but when Jessie May come around, it's just like, it's like a huge relief. It's like you've got family like relations coming around.
Having the same people coming in allows you to build up like a good, solid, trusting relationship.
Loren's very happy when they come to visit. We always tell Loren in the morning when she's got a Jessie May, and the moment we sort of tell her, guess who's coming, she gets very excited and she laughs and she giggles.
We don't really focus on diagnosis with children. It's more about focusing on them as individuals, like how they communicate their likes and dislikes and what they enjoy doing.
Like when they come round, instead of being like, okay, it's feeds and medicines, it's more like it's playtime. So it's like having like an auntie or an uncle come round and just spend time.
Tell her who's coming round and you immediately get that laugh or a giggle or a bit of a twinkle in her eye. And she sort of like is happy then until she walks in the door.
Yeah.
We get to do lots of really nice things. We get to know families really well. We build up lovely professional relationships with families, and it means that we're able to get to know the children and like provide really like personalised and individualised care.
But I think that's why Jessie May is so important, because we haven't got the family support around us. So that's why it is our normal.
I think what makes Jessie May a special charity are the families and the children. I think it's lovely that we're able to come in to people's homes and support them in the home.
I think the respite visits for us are so important, because we can literally ask another person to be the carer, so I can be mum.